super grateful. Dr. Hakimi has been with Liftique since conception, obviously. He's our chief medical director. He's an exceptional board certified plastic surgeon, incredible care of all of his patients. I've had the great fortune to be able to work with him over the last few years, and he's an incredible doctor, but an even better person. So I have so much gratitude to turn the presentation over to Dr. Michael Hakimi.
Hello everyone, thanks for joining us today. Today, my goal is to talk about only a couple of procedures that give you the most impressive result with the shortest downtime. You see, there are procedures that you can do all year long: a tummy tuck, a breast lift, an arm lift. These are procedures with a couple of weeks of downtime. They come with a surgical scar and they need a lot of preparation, right? But there are also procedures that we see a surge in right around summer, springtime. These are the procedures that will make you ready for your, summer goals, whether you want to call it a summer body or something that improves your self-confidence in when you get into bathing suit. Most people, when they show more revealing, they show more skin in their clothes, they would like minor improvements here and there. And I will try to focus on those procedures today. The most basic one of all is a breast augmentation. Most of you have heard about breast augmentation. It's fairly simple for planning. There are only a few questions we have to answer when you come to our office for a consultation. The first question is what size of implants you would like to have. What type of implants do you want? Saline, silicone. Where do you want the implant to be placed? And what type of scar would you like to have? And we're going to go over how we decide today. So geometrically speaking, every time we do an examination for someone for breast augmentation, we measure your base width. We measure the size of your breast, which is pretty much half of your chest size. And that would tell me what is the maximum size implant I can place in that patient. As you can see, there are charts. This is a very well done science that depending on how wide your chest is, for example, someone who has a 12.2 centimeter chest width, the implant that they can afford is a 225 cc implant. Okay, now could we put more volume in the same patient? Yes. That's when the profile of your implant comes into play. The higher the profile, the larger the implant, the more three-dimensional the implant is. Therefore, we can put more volume in the same chest wall width. For example, let's take the same number. A 12.2 centimeter, that would be able to accommodate a 225 cc implant of a moderate profile implant, could go up to a 400 cc implant if we use a high profile implant. The high profile implants, they have more projection, meaning in an anterior posterior way, they show more, but that's how it's a trade-off for being able to put more volume in your chest. And this is the discussion that we're going to have during your consultation. What type of look you would like to have? People that want they want a moderate improvement without much projection, they go mostly for a moderate plus profile. High profile is for patients that don't mind people knowing that they've had a breast augmentation, but they want to make sure that they have that size. Now, while we're on these numbers, the most common question people ask is, Dr. Hakimi, I'm a 32B and I want to be a 32D. What size, how do I know what size volume would get me there? And it's a very difficult question because as all of you know, 34 double D Victoria's Secret is very different from 34 double D another company. These are very subjective. And to take that subjectiveness out of the equation, we always try to talk about numbers. One way to go about it, rule of thumb, is every 150 to 200 cc implant equals 1 cup size. So if someone wants to go from an A to a full B, they're going to go with about 200 cc implant. An A to a C, that's about a 350, 400 cc implant, assuming that their chest is wide enough to be able to accommodate that much volume. Now, keep that in mind. Now, with today's technology, we have softwares that we can actually scan your body and place an implant in it when you're wearing a virtual reality goggle, and that would show you what your breast would look like with different types of implants. And you can see in a virtual reality world, you can see what you would look like in bathing suit, different clothing. You can look down, you can look in the mirror. This is all done by computer 3D simulation. Takes that guesswork out. My patients, when they go to sleep, when they wake up, there's no surprises. By the time you go to sleep, we've agreed to a number. You know that you're going to get a 300, 350 cc implant, and that's what you get when you wake up. It takes the guesswork out. Now, what's the difference between saline and silicone implants? Here, saline to silicone is like Volvo to Mercedes-Benz, right? If you drive a Mercedes and you have a flat tire, these are flat run tires. You can go for about 50 miles before you actually need to change your tires. A Volvo, when you get a flat tire, you have to change it right there and then. A saline implant, the one on the left side, on the right side of your screen, if you rupture them, you just have a flat chest. You call me, we schedule you for a procedure, you come in and we replace the implant for you. A silicone implant, if you have a ruptured implant, you won't know for a few years until it turns into capsular contracture and some sort of pain or whatnot. That's why FDA recommends some sort of seeing your doctor every year. So clinical examination can tell you whether you're going to have any, whether there are any signs of rupture of your implant if you have silicone in. Silicones do feel more natural. They are less palpable because the quality of the implant is closer to your own natural breast tissue, as opposed to silicone, as opposed to saline implants, where it feels more like a balloon because it's water in a silicone shell. Now, the other question people ask is, what's a gummy bear implant? Majority of implants that we use here are round implants, and there is a specific type that's called an anatomic implant. This implant is round until it's placed in your chest. When you stand up, it takes that teardrop shape of your breast. This implant looks like a teardrop even when it's on the table. This one helps form your breast shape. This one forms with your breast shape. The round silicone implant is the most commonly one used for cosmetic procedures. This I personally don't use as much for many reasons. It's mostly for people that have zero breast tissue. It's more commonly used in breast reconstruction for patients who've had mastectomy. Think about it. If this moves in your chest, it's round. Nobody would know. If this moves in your chest, you're going to have a lopsided chest, right? Because it's formed like a teardrop and you want it to stay in a specific position. Why is it called gummy bear? Those are both gummy bear. Those are both gummy bear implants, whether it's round or anatomic. If you've ever had the pleasure of cutting a gummy bear, it doesn't leak out. The older generation implants 30, 40 years ago, when they would rupture, it would look like a melted gummy bear in your chest when we would go to remove and replace it. However, the new generation, if you get a rupture, it's very unlikely to have leakage out. It stays more contained, makes for less complications in the future. There are three different main companies: Allergan, Natural, Mentor, and Sientra. We use all three. They're all made in America, and they're all FDA approved. Now, the other question we have to answer, so by now we know the size, we know the type of implant. The other question we have to answer during your consultation is, where would you like to have the scars? The three main ones that you've seen probably is under the breast, under the nipple, and in your armpit. They're all done frequently. I personally use this one 95% of the time, and I'll tell you why. But under the nipple and in your armpit are equally great procedures. Some anatomy lessons. This is us looking at your breast from a profile view. This is your nipple, this is the breast tissue, this is your chest muscle, and this is the rib cage. When the implant goes in, if we choose to go from under the breast, we can easily lift the muscle and slide the implant in without touching the breast tissue, without disrupting the nerves and the breast tissue here. When we go from under the nipple, you can imagine that we have to cut through this spongy tissue to get to the chest wall. Now, this spongy tissue, your breast tissue, is not a sterile environment because through the nipple, it communicates with the outside world. That's why these incisions underneath the nipple, they are known to have a higher rate of infection and capsular contracture because we can't really control the sterility of the passage where the distance that it takes to go from the skin to the chest wall, as opposed to under the breast, that's an easier, less traumatic way to the breast. I also tell patients, if you don't scar well, if you have pigments in your skin, if you go from under the nipple, sometimes you can have some darkening underneath it that when you're nude without a bra, you're going to be able to see the scar. Not all the time, but if it's under your breast, nobody can see them unless you actually lift your breast to show the scar, like this woman. She has a scar underneath her breast. This scar could be as dark as you want when she's standing up, or even when she's laying down. It's very hard to see unless she physically lifts the breast. So these are my two main reasons that I personally favor the incision under the breast. It's never more than 3 centimeters, which is less than 2 inches. And it always heals very well without any complications. Now, when we do the breast augmentation, we have to cut the muscle edge to put the implant under. For that reason, the main restrictions that patients have is not being able to lift heavy objects for about a month after the procedures, 4 weeks to 6 weeks. Now, it doesn't mean you can't go to work. It doesn't mean you can't, quote unquote, wash the dishes. Nothing heavy more than 6 pounds. So frequently patients who have little kids at home, they have to make arrangements for somebody to take care of them because you can't lift your baby. That's the main restriction. The recovery is not major. Now, briefly on transaxillary, putting this in your armpit is also a relatively common way of doing it. I personally don't do it for 2 reasons. It's a little bit of a blind procedure. When you make an incision here, you don't get to see the entire breast anatomy. You don't really get to design the pocket as much. And when you do this, you drop the implant into the breast pocket. In the future, when you need remove, replacement, or if there is any issues that you need a revision, you can't really revise this through the same armpit incision. You have to opt for one of the other 2 main common ones, whether it's the nipple area or under the breast area. So for very personal reasons, I don't perform this. It doesn't make the procedure wrong. There are many plastic surgeons that perform this procedure. It's just something that I choose not to do. Well, now we went over this, majority of people get the implant under their breast because the muscle lays over the implant and makes for a smoother transition between your chest wall and your breast, gives you a more natural look. Also, the muscle protects your implant from touching the breast tissue, making it a more sterile environment, less likely to have capsular contracture or any issue. In rare situations, you might have friends that their plastic surgeons recommended putting the implant over the muscle. I do it sometimes in patients that either really like the augmented look to see that transition, or patients that have a lot of droopiness in their breast. They are borderline breast lift patients, but they don't want to have a lift. Sometimes you can get away by putting the implant over the muscle, knowing that you can buy a few more years before your patient actually needs a breast lift, which would come with more scarring, more visible surgery. We talked about pre-op planning. Now, there are things that are going to happen to you just by the virtue of having breast implants. We call them inherent risks. For example, capsular contracture, potential for getting stretch marks. I don't call them complications because it's going to happen to you at some point in your life. It's a matter of when, and we're going to go over it in more detail. Now, there are things that are not supposed to happen to you, like getting your breast on fire in this movie, if you remember, or having infection, bleeding, asymmetry. Those are complications, and we're going to go over the difference between the two. I don't need to remind you that many people, when they go to consultation, they want them as big as possible, forgetting the fact that when you go shopping, you have to match, right? You know better, I'm not going to talk about this, but keep the big picture in mind that when you go shopping, you want to be able to buy something that matches top and bottom at the same time. If you're very active and you opt for a large size implant, you're going to need a lot of support. And as you might have seen online, a lot of people are complaining about back pain and neck pain after breast augmentation. Is it normal? No, not everybody after breast augmentation gets discomfort, but look at the numbers that these patients have. They have 750 cc implants on each side. That's more than a large bottle of Diet Coke. That's a lot of weight. So things that people need to think about is the lifestyle that you want to be able to have after you get your augmentation. The heavier the implants, the more straining on your neck, the more support you need when you go for jogging or walking. Same again, another person with 600 cc implant asking on Real Self whether it's normal to have back pain with breast implants. The other thing I tell my patients is when you come for a consultation for breast augmentation, you're prospectively designing how your breasts are going to age over the next few years, over the next few decades. The heavier the breast implant, the more likely it is that gravity pulls them down more than before. Basic physics from high school, right? The heavier the mass, the more gravity is going to pull it down. I personally think majority of patients that come in later in life, in their 50s and 60s for breast lift, they've never had an augmentation. And in my personal opinion, patients that get breast augmentation earlier in their life and heavier, they come in complaining of droopiness at an earlier stage. I do breast lifts on a 40-year-old now, not infrequently on 39, 30, 38-year-olds who had augmentation, a decade or two ago. So keep that in mind as you think about breast augmentation. It's not just the immediate results of what you want to look like for this summer. It's what you want your breasts to look like over the next decade or two. Also keep in mind, when you go to your plastic surgeons for remove and replacement, right? These implants have a shelf life of 10 to 15 years. So chances are within the next 2 decades, you're going to go in to remove them and change them. Because your skin stretches over time, just aging, the implant being in your skin, most likely your plastic surgeon is going to recommend you going up on your size by 50, 100, or 150 cc implant. So if you choose a 400 cc implant today, think about in 10, 20 years when you go back, are you willing to go up another 100, 150 cc? Or are you going to be okay with making your breast smaller, but the trade-off is you're going to need a breast lift scar? Something that people don't talk about is stretch marks. You can get stretch marks with breast augmentation. Now, not everybody gets them. We don't talk about it as much, but it's a real complication. And these are real patients. Who gets them more often? It's for a 20-year-old, 25-year-old with no history of pregnancy, with a tight breast skin that opts for maximum size. Unfortunately, there is no real way of guaranteeing somebody will or will not get stretch marks, but I always warn my patients, especially the younger ones who've never had pregnancies and they really want them big, that if you get this, there is very little we can do to treat them with, with microneedling, profound laser treatment. But you want to be conservative for many reasons. This is one. Capsular contracture. If you've ever done your research on breast augmentation, you might have heard this word. All that means is there's a scar tissue that forms around the implant. Everyone that has a breast implant has a little bit of a scar tissue that's very slippery and soft, and that's what helps the breast implant move around on your chest. Sometimes, for the reasons that we still don't really know, that scar tissue becomes hard and calcified. As this scar tissue gets harder, it makes your implant round up, get hard, and sometimes get painful. And you can see it changes the external look of your breast. This is a patient with capsular contracture. This is the capsule, the shiny layer, and the implant removed and now replaced with another implant. And that's the main treatment for this problem, is removing the implant and replacing it. What can cause capsular contracture? We don't really know, but there's good evidence that things like smoking, chronic UTI, meaning if you get an infection frequently in your bloodstream, guess where it would sit first? It's going to find a foreign body, which is your implant, and it might aggravate and make this scar tissue harder, leading to capsular contracture. So I tell my patients frequently, those who get a breast augmentation, that if you get dental work done or any UTIs, don't let it go untreated and try to treatments and antibiotics as soon as possible. Some of you might have heard of this new phenomenon called ALCL, which is a fancy name for a new type of lymphoma that has been associated with breast implants. It's not breast cancer, and it's really not lymphoma. Over the last 5 years, out of millions of patients who've had breast augmentation, plastic surgeons have noticed a small percentage that have fluid around their breast.
Michael, I'm going to step in here. Hi, everybody. It's Russell again. If you could kindly mute yourself. And Dr. Hakimi, you're the host. If you would just take a second to mute everybody but you.
I was trying, but there is one of our, okay, thank you.
All right, so that allows you to stay focused and people can cough or whatever. Are we good?
Yes.
Okay, so we'll take it from the top there, and that allows us to have a great experience and you can hold your focus. Thank you so much. Okay, back to you.
So some patients show up with some fluid in their breast. When the plastic surgeon send us fluid for lab, it looks like lymphoma. Now this has if it's caught early on, it's very unlikely to cause any problem. The treatment for it is to remove the implant and the capsule and replace it. And it's mostly associated with patients who've had textured implants. So you remember a few slides back, we talked about how the round silicone implant is the most commonly used implant in cosmetic surgery. Out of all those patients, none of them have only had that implant. So I'm not concerned about it, but it's something that you need to know, because every time you get a breast augmentation, this is going to show up on your consent form. And just to put it in perspective, chances of let's see if I can go back. Chances of getting it is lower than me getting into a car accident, leaving home for work. It's 1 out of 300,000 people. Now, let's talk about risks, the stuff that are not supposed to happen to you. Hematoma is a fancy name for bleeding. Seroma is a fancy name for fluid formation around your breast. If any of these happen, we bring you back to surgery, we fix it. Asymmetry. Obviously, you're not supposed to look lopsided. Every breast is a little asymmetric to begin with, and breast augmentation doesn't really make them symmetric. It improves both of them, but they're going to have same level of asymmetry even after the breast augmentation. So I always point out the difference between the two breasts to my patients, and I tell them, listen, they're not twins, they're sisters, and we're going to keep them sisters after the procedure. But there is going to be a little difference that you already have before the procedure. And most patients, I'm surprised how they don't know this before to come to procedure. When I show them in the mirror, they're always surprised that I never noticed one breast was large, slightly larger, or slightly wider than the other breast. Now, something about sensation to nipples. Back then, 10, 20 years ago, we thought the incision around the nipple makes it more likely to lose sensation in that breast. New studies have shown that the size of your breast implant is even more of a deciding factor in who gets problem with the nipple sensation than the incision itself. Patients that get more than 400, 450 cc implants, we think that implants stretches the nerve and causes not necessarily loss of sensation, but less sensation in that nipple. And interestingly enough, when patients get the implant out for any reason, they always say that the erotic sensation has improved in the breast, and we think it's because when the implant is out, the nerves go back to their normal state. Now, having said that, about 3 to 4% of patients, they get complete loss of sensation in either one breast or one nipple when they have the surgery done. And it's because during the procedure that we open up a pocket to put the implant, sometimes that nerve gets damaged, and that's unfortunately a very minor risk that is involved with this procedure. I tell my patients, unlike anatomy books, unfortunately the nerves are not colored, and sometimes during the procedure they can get nicked. As far as recovery, you're not going to need pain medication more than a day or two. It will be very surprising for me if my patients need pain medication more than a couple of days. They all shower the next day. I tell them to go on a date if they can. They go shopping because I want them to try different clothes on so they start moving their shoulder. The more you move your shoulder, the more you go back to your normal level of activity, the faster your breast muscle gets back to normal. And the more you avoid doing your normal routine, it gets stiff and it's going to be hard to come back to normal. You're going to have a sports bra for about 3 months because you want the implant to drop into that teardrop natural look before you start wearing an underwire bra that might keep everything too high. I don't believe in massaging. Some of you might have heard or seen online that some plastic surgeons recommend massaging to prevent capsular contracture or make it look more natural. Since I started my practice, I've never been a fan of massaging it. I feel like in the surgery, I designed the pocket very precisely, and I would like the implant to stay where I designed it. So I've never had my patients massage it. I think that it works for me.